test here, I have the shoulder abduction test. Mike is going to be the patient. Mike, I'm going to be doing a few tests on you today. Is that okay?
Yep.
So the first, the instructions to the patient. Mike, can you please do this motion for me? You're going to put the back of your forearm on the top of your head. Okay? And you can put it down now. Now, if this decreases the patient's symptoms, if they're having any numbness or tingling before this test, and then when they do that motion, it decreases, that is going to be a positive test, and it's going to be a sign that they have radicular problems, some kind of nerve compression. And the values for this, sensitivity is 17, specificity is 92. So it's helpful for ruling in the condition, but not for ruling out the condition. Positive likelihood ratio 2.12, negative likelihood ratio is 0.90. Because of those values, this test has a slight favor that it is helpful for ruling in the condition. The next test is cervical rotation lateral flexion test. For this test, you're going to rotate the patient's head to the opposite side of the affected side. So let's say Mike is having problems on his right side. I'm going to passively rotate Mike's head to the left, and then I'm going to bring his ear towards his chest, bringing his cervical spine into flexion. And how's that feel, Mike?
That's fine.
Okay. You're then going to repeat on the opposite side to assess for any differences in motion or symptoms that the patient is having. So I'm going to rotate Mike's head to the right, and then I'm going to flex his head, bringing his ear towards his chest. And a positive sign, positive test for this is that you're going to feel a very abrupt block when you move that patient's head into flexion. They're not going to be able to do that motion. It's going to be very abrupt, and you're going to feel it at the beginning of the motion, and that's going to be indicative that this patient possibly has thoracic outlet syndrome or brachialgia. And there were no lab values, sensitivity, specificity, or positive and negative likelihood ratios. However, there was found to be excellent inter-observer repeatability for this test. So that's going to conclude the test. Thank you, Mike.